The CDC will meet today to decide if children as young as 12 can get the Pfizer vaccine. If it is given the green light, shots could begin as soon as Thursday. The agency is expected to meet at 11 a.m., and a vote on its recommendation later today comes after the FDA gave its approval on Monday. Meantime, CDC is defending its guidance on wearing masks outdoor after attacks from GOP lawmakers that the agency is publishing outdated information that fails to highlight the diminishing risks of contagion. Dr. Neeta Ogden is an internal medicine specialist and immunologist, and she joins us now to discuss the latest developments in the vaccination effort. So, doctor, the CDC says that the chance of COVID-19 transmission outdoors is roughly 10%. However, a New York Times report puts it at less than 1%, which could greatly impact COVID-19 guidance. So, did the CDC exaggerate those numbers? And if so, should they revise them, or are they accurate and it's just the Times that perhaps is not right about what this number should be?
Good morning. I think that this, story really highlights how we're kind of in a transition point with the pandemic. And I think that the CDC does need to revise these type of guidelines. More epidemiologists and experts and studies are showing that outdoor transmission is really minimal. It is more likely less than 1%. Some epidemiologists say less than 0.1%. So why is the CDC stuck with these very conservative benchmarks like less than 10%? And I think it in part has to do with what we've discussed before, that when they came out with these kinds of recommendations, we were still in the middle of a novel coronavirus pandemic. But now more people are getting vaccinated and they're looking to the CDC for guidance. And those kinds of conservative messages are becoming somewhat outdated. And other people are criticizing the CDC that their messaging is also too complicated. At this point, with people getting vaccinated and the country opening up, and now we have adolescents in schools and many things. I know the CDC can't necessarily weigh in on every single community, but I do agree that they should start looking at revising some of these recommendations so that they have a more practical impact on our lives as we emerge from the pandemic, and really offer simple messaging. I often find people saying, well, what did the CDC say about the travel quarantine or this? And it often does, fall to the states to finally give what they recommend. But I think it would be helpful if these types of things are changed within the CDC. That high benchmark of 10%, in fact, came from these studies around construction workers in Singapore. We have more data now. When we have more evidence about outdoor transmission, they should really be revising the message based on that.
And, part of the reason why it's so important that there's clear messaging coming from the CDC is because, people look to the CDC for messaging on all types of things related to the virus and other things. But sticking to the virus, we know already that there's a segment of the population, parents, that are very uncertain about allowing their children to receive this vaccine. The CDC would like parents to feel comfortable, but they can only feel comfortable if they feel like they're getting clear messaging from the CDC. So I'll pivot to this topic right now. The CDC is set to determine whether or not children as young as 12 can receive the Pfizer COVID-19 vaccine. Help us understand the impact that this could have on America's fight against COVID. Pfizer says it's 100% effective, even more effective in children than it is in adults.
Yeah, I think it's an exciting, moment and juncture that will really get us on the path to normalcy, because it involves children going back to school. And even though people are saying things like, well, kids don't get that sick. I mean, they do. There are over 1 million kids had COVID vaccine during this pandemic, and we saw really severe cases of the multi-inflammatory syndrome, which often occurred weeks after what appeared like a normal infection that resolved. So there are concerns about children, but more importantly, what we're seeing around the country, around the world and the country, is that if there's an unvaccinated population, there is the opportunity for the virus to mutate, and that leads to variants, and that can break through vaccine immunity. So there's that. And then there's also, just like I was saying, getting back to school. Having these adolescents have more normal lives where they can be around their peers is going to be so essential to normalcy and really getting past the pandemic, especially in the fall. So I think this is a really huge and vital step. I know that some parents are hesitant, but I think people, adults over 16 were hesitant when the vaccine first rolled out in December. And as more people got vaccinated, we saw sort of the freedoms opening up to people who got vaccinated, and that they were relatively okay aside from those minor side effects. Other people got vaccinated. I think we'll see that happen with this age group as well.
All right, Dr. Ogden, we got to let you go. We have so many more things to ask you, but next time you check in, we'll pummel you with questions again. Thank you very much.
Thank you for having me.